Every year, there is a GP survey that's sent out to patients in terms of evaluating their practices. This sends out normally in January, and in this episode, we're going to cover the results that came out this July, talking about what they mean, what kind of questions have been asked, and is this the best way to find out how general practice is functioning? So let's join us as we tech enhance our primary care and learning. Hey Andy, so in this episode we're talking about the GP survey. So this is an annual survey that goes out to patients to basically figure out what they think of general practice. What do you think?
Yeah, it's an interesting survey. We've been looking at this for years. We didn't look at it last year because of COVID. I'm not sure whether it was done last year or not. I think they are presenting some data from last year, so it must have happened. I believe there's a requirement to reflect on the results of the annual GP patient survey for those
Hmm.
of us who are administering NHS GP contracts. And it's one of those things that CQC, when they come and inspect services, are always keen to have a look at and see that you have looked at it and know how you are responding to the data that's presented there. So it's actually a really important part of general practice.
Hmm.
We had our meeting in practice to look at our data a few weeks ago, and we had some interesting discussions about it, including actually for the first time questioning whether this is the right way to get patient feedback
Hmm.
anymore. So I'd be interested to spend some time on that at the end. I'm just all we're all set up to give you sort of a walkthrough through the website, show you how to use it if you are a practice reflecting on this for the first time. Hopefully not, but if you're new to practice and you want to start having a look at this data, it will be an interesting walkthrough. And also, if you're a patient or you're a GP and you're a patient at a different practice and you want to see how your practice is performing or compare your practice with other practices, we'll sort of show how to do that as well. Yeah, any reflections on the survey, Gandhi, before we move in?
No, just to say that it's readily available, as Andy mentioned. So if you do want to go to it, the website, we'll put the links down below and stuff or in the descriptions. It's something like gp-patient.co.uk or something like that, but we'll come to the exact link shortly. And if you do find this episode useful, just let us know by giving us a like right now to let us know this is useful content to yourself. As Andy mentioned, we're going to go through the actual website, the survey results nationally, and you can drill down and look at this more regionally. As you can see from the website that we've got right here. So talk us through it, Andy.
Yes. So you've described the URL exactly, gp-patient.co.uk, and this is really the landing screen. So it's quite nicely designed, presents the
Mhm.
data fairly well. You can search for your specific GP practice by practice name, by postcode, by practice. So if let's do a search by postcode for uh, the practices near me. That's the postcode of our practice. So we should be able to see, yeah, so we're co-located with Lean View Surgery. And these are the other practices in the area. So these are our primary care network practices. So it might be interesting for primary care network clinical directors and staff to have a look.
Mhm.
The sort of the interesting thing you can do is compare one practice with another. So you can select up to a number of practices to add to the compare function. Practice is a little the thing is a little bit slow, so we could compare Lean View.
Yeah.
I'm not really intending to show data for individual practices, so let's just stick with the principle that we could add some further practices to the compare, and it would compare them side by side on whatever
Mhm.
criteria we were selecting, which I think is really, really useful. Let's use the back button to go back
And
to the main thing.
just as a tip, what I would suggest to those that are planning on using this tool would normally recommend searching by postcode, just because sometimes practice names don't always match up to what you may think when you go through some of these surgeries, these surveys and stuff. So, for example, our practice is called Wellspring Surgery. Sometimes in certain things it comes up as AT um, uh, partners, for example, because of legacy issues with the way that things are named and that kind of stuff. So, although it does help by giving you the postcode for the relevant practices. As you can see, there's lots of practices that start off with Parkside Practice Medical
Yeah,
Practice.
it's
So,
quite a generico name
mm,
for a GP surgery, unfortunately. So there's lots of them, and we're not even making the first page of hits. So yeah,
yeah.
just going with your practice postcode is probably the best way to
Mhm.
do it. So you can look at individual practices and compare individual practices. You can do some other interesting things. So let's have a look at the analyze tool. So you can dive straight into the 2021 results, or you can look at trends over time, which I think is
Mhm.
quite interesting. So that's something we'll probably look at today. And then you can look at, again, individual practices and their trend over time. And that's what we did when we looked at our performance as a
Mhm.
practice, because we're really interested to know what difference the various measures and things we're doing to try to improve services, what difference they're having on the results. You can look at CCG level, or you can look at national results. So we're a national podcast, maybe even
Mhm.
international. So let's look at that. And then you
Just one
get to,
thing I probably would suggest they consider looking at is whether they look at PCN groupings as a way of reporting. That'd be a really useful way, I think, of presenting some of the information for other aspects of use. But obviously that's not done just yet.
shall we see? Let's have a look for Nottinghamshire CCG. Let's see. Do wonder. Results found. No, it just takes us straight into the results.
Yeah.
So, but if we were, let's move to our next tab. So if you look at national trends,
Mhm.
then you get a long list of all the questions that are asked in the survey, and you can select those that are of particular interest to you, or you can sort of select all in a certain area that's of particular
Mhm.
interest. The areas they look at are just general reflection on your local GP services, the experience of making an appointment, um, what happened at your last appointment, which is quite an interesting section, overall experience. And then there are some questions about the person taking the survey, like their health
Mhm.
and what their burden of disease is in their eyes. And then there is an interesting section about what you do when your GP practice is closed, which I think asks some interesting questions, some additional questions for the COVID-19 pandemic, and then again, some more questions about the person. Shall we just reflect on some of the questions that are asked?
Mhm.
Um, I know we were looking at what we thought would be insightful to look at and picked out a few.
Mhm.
Yeah, what do you think about these questions in the local GP services area, Gandhi?
I think they're reasonable. There are various different ways you can look at the different types of questions, but it talks about how helpful staff are at trying to make appointments and that kind of stuff. There's a massive focus, as you will find, on appointments, not necessarily services. So it seems to talk more about that, and that's not uncommon. We know access is the key thing that the government in particular likes to focus on. I mean, what do you think, Andy?
Yeah, I mean, I think the survey is designed to be focused on the patient experience, and NHS England will tell us they have other intelligence on practices about their performance and outcomes in other areas, and we
Mhm.
might talk a little bit about that later on when we're talking about the best way to measure the performance of a practice, and that this isn't necessarily the be all and end all tool. So
True.
yeah, there's a focus on access and experience of having that contact with the general practice. I think a lot of the questions make a lot of sense, really.
Mhm.
A lot of them are uncontroversial. These are the ones we'd selected to drill down on, and we'll have a look when we're looking at the results that we've generated. So they ask about general satisfaction with the availability of services, the experience of making that appointment. You know, how easy was it to get through on the telephone? How did you make the appointment? Were you happy with the range of appointment times that were presented? Those sorts
Mhm.
of questions make it helpful. One thing I would say is there's a lot of questions, and I do wonder if in this day and age when people have shorter attention spans and are often asked all sorts of to complete all sorts of questions and surveys, whether all of whether the overall result of the survey might be better with fewer questions, getting more responses to improve the quality of the data rather than
Mhm.
asking a number of questions which they're not too similar actually, but I just wonder whether all of the questions are absolutely necessary.
Mhm.
Look at make an appointment, and then they look at the experience of the last appointment. I know this is something that we look at all of it, but we concentrate on this area for more of the good news results,
Mhm.
because you tend to find people are really, really unhappy with access, or fairly unhappy with access, or they're
Mhm.
the most unhappy with access of the other bits. Um, but often you get some quite nice, reassuring things to share with the clinicians about their experience of seeing the doctors and nurses and whether they felt listened to,
Mhm.
and whether they trust the clinicians. And that's where you tend to get more positive. Um, there's some question about overall experience, and then yeah, it's just about the person filling in the survey. So as a practice, you get an idea of the type of people who are filling in the survey for you, and
Mhm.
how people in the population see their own health. Um, yeah, shall we dive into the results?
Yeah, let's go for it. I think, so one thing to mention, so as you can see, we've selected about, I think it's about 15 questions to look at in more detail. The processing time when you click select, it does take a while. I think it took about 3 or 4 minutes, didn't it, Andy, for it to load up. So not to be surprised if it seems to take a while to analyze it. And that was just with about 15 questions.
Yeah, I was. I was tempted to click the refresh button, which would have been
Mhm.
the wrong thing to do. So just, yeah, leave it in a tab, let it do its business, and then come back to it later. And it does provide the results. So you can download them as an Excel file and do additional things with
Mhm.
that data, which is often a useful thing to do. Or you can download it as a PowerPoint file, which is what our manager did when they showed us the
Yep.
data and circulated the data around. So it almost prepares a presentation for you. In fact, I'm going to click that, and then we'll perhaps come back to that later when it's downloaded, and we can just see what that output actually looks like. So in doing that, I think I might have killed the outputs that we're waiting for us to have a look at, Gandhi. So
Oh, no.
we'll have to cut here and come back after processing time. And we're back. So we allowed a little bit of time for the computer to do its thing there, and we're back with the results. So let's start to look through these and focus on anything that really jumps out of us that we think is of significance at a national level. How easy is it to get through to someone at your GP practice on the telephone?
Mhm.
What do you think of this, Candy? It's not moved very much.
No, so statistically, it doesn't look significantly different. It's interesting that access seems to have improved this year compared to last year. I think 2020, we're going to question how accurate the data is from that because that was mid-pandemic. So there is a different experience, and actually, we know that more patients are now speaking to their practice by phone anyway. So it's interesting. I think this may speak to some elements of the demographics of the people who fill in the questionnaire. And we don't have that particular information, but we're going to come to that point towards the end, aren't we?
Yeah, so that's interesting. Yeah, and I think then, if anything, there's perhaps a story of some adaptation to
Mhm.
improve telephone access. Following a low point in 2020 during the pandemic, but not that much difference over time, which
Mhm.
is interesting. I think. How often do you speak to your preferred GP when you would like to? So there's been a reduction in
Yep.
this from 50% 2018 to 45% now, which I think is what I would expect really during the pandemic when there's been
Mhm.
increased demand and staff problems, or well, a period of decreased demand followed by a period of increased
I'm
demand in the
surprised it's
service.
not lower, to be honest, if I'm being absolutely clear. I was expecting that to be much lower than what it shows. So, yeah.
Wow, which brings we'll make this reflect. I'll make my reflection on that point in the data in a little while.
Yeah.
Um, but before you tried to get this appointment, did you do any of the following? So this is a new question. It
Mhm.
appears that hasn't been asked in specifically this way before. So we've only got the data from this year, which is a real shame because this would have been really interesting to see how it's changed because it looks at whether people rang 111 first or
Mhm.
used an online service to get information, spoke to a pharmacist, etc., etc. And actually, it looks like people do try and do other things, if this is to be believed, before they call the GP practice.
Mhm.
It's only 42% of people have said, I did not try to get information or advice elsewhere. So it does include things like
Mhm.
using non NHS online service or information online, which I think is really, really broad.
Mhm.
I'd love to know what that looked like a few years ago, to be quite
Yeah.
honest.
I'm
Any
keen
reaction?
I would love to know what that asked advice from a friend or family member question would have been about 10 years ago.
Probably higher.
Yeah.
Yeah, and probably less use of online services.
True. Yep.
It's but interesting, but we don't have the data, so that's a
No.
shame. When would you have liked this appointment to be? So this is something that we actually look at fairly closely as a practice because
Mhm.
it then allows us to decide on our ratio of uh, on the day, same day appointments versus advanced bookable appointments and when they're
Mhm.
released. Because you never get that right as a practice, and people always, there's always a problem with it because you can't
Mhm.
satisfy everybody. So we take the approach that actually, if we take a data-driven approach, when people don't get what they need, we can at least say, well, this is evidence-based, based on this
Mhm.
data. That's what's informed the ratio of when we release our appointments. Um, and we're hoping through doing this that we satisfy the maximum number of patients, and we monitor this on an annual basis. So
Mhm.
it's interesting, but yeah, so the number of people wanting an appointment on the same day has gone down over time,
Mhm.
and people are sort of wanting it the next day. I didn't have a specific day in mind as the area where it's gone up the most,
Mhm.
which is interesting because you get the impression that more and more people want things more and more on the day, don't you? Working in
Yep.
general practice because of the amount of demand, but and it might be that the demand's gone up. So perhaps the actual numbers of people wanting appointments on the same day, because there's just a greater demand for a number of appointments in
Mhm.
general, has gone up, whilst the proportion actually wanting the same day has gone down of that greater number of appointments. Any reactions from you, Gandhi, or can you puzzle this out?
I am gonna go down to the root. I think this is the demographics again.
Do you think? Okay.
Yeah. So, we're gonna talk about this in a second, but is it down to the type of people that are filling in the survey rather than the actual data itself? Because I think this would be different if this was filled out by the population as a whole.
Does this reflect reality?
Yep.
But anyway, interesting. And obviously that drives a cart and horses to our approach of using this to inform our appointment policy, doesn't it?
True.
But where is the other data?
Mhm.
So what type of appointment did you get? So this is the pandemic here, isn't it?
Yeah.
Big, and actually I think when you ask people in 2021, and we'll get to this later, they're actually recalling their experience of an appointment that wasn't in 2021, because it
Mhm.
asks you about the last time you had an appointment, and these are randomly selected patients. So
Mhm.
a lot of them, their last appointment will have been the year before, or even further in the distant past than that. But we
Mhm.
see much more use of telephone appointments
Yeah.
during the last year, and much less face-to-face appointments. And in previous years, that the use of video calls has never actually generated a whole percentage point, and now there's
Mhm.
3% video calls,
Yeah.
which is a really huge increase. Although still a very minority of the appointments are using
True.
video calls, and home visits have sort of dropped down to less than 1% as well. That's really interesting data, and I think it's just telling us what happened in the pandemic. I think the interesting story will be what happens next. Do we
Yep.
go back to what it was before or not? This is always an important one. Overall, how would you describe your experience of making that appointment?
Mhm.
And that's better in
Yep.
2021. I thought that would not be better in 2021. Interesting. And fewer people are saying that they had a poor experience of making the appointment.
Mhm.
I find that I find that fascinating, given how we often reflect on the stories in the media about GP access and appointments, and that's
Mhm.
not borne out in this survey. It's really interesting. And when was your last GP appointment? So this is when. So this is the appointment they're reflecting on.
Mhm.
And in previous years, it's been about 70% in the last 6 months. So it was just half of people having an appointment in the last 6 months with this. So people are thinking back further than 6 months when at least half of people are responding in 2021, they're thinking about further than 6 months. So they're really recollecting about the reality in 2020 or
Mhm.
before then, even.
Potentially, yeah.
Last time you had a general practice appointment, how good was the healthcare professional at listening to you? So this has remained rock solid, uh,
Mhm.
89, 88, 89%. So people are generally having a good experience of being listened to, which is really reassuring. These are the ones that we tend to share more widely with our staff. I mean, we share it all with the staff actually, because we look at it in a staff meeting, but we um, often you need a bit of a morale boost, certainly at the moment with the staff. And we say, yeah, the patients still feel listened to,
Mhm.
which is which is really, really, which is really, really good. Um, how last time yes, were you treated with care and concern? And again, this remains, really, really high. And I think this, indicates that there's still a lot of faith in general practice, in the
Mhm.
profession, and in the other professionals that work within general practice. So that's really positive that
Yep.
that's not particularly moved. Confidence and trust, again, it's a similar question. 96%, really, really
And
high.
that's pretty amazing. 96% of patients that filled in the survey said that they have trust in their clinicians in terms of the advice that they've been given.
It's good. Let's just celebrate that for a moment. I was listening to another podcast and they were saying what we don't do psychologically is like celebrate the wins. We very quickly move over them and say, okay, box ticked. But we spend a lot of time talking about the negative things, and that
Mhm.
gives the impression that things are sometimes worse than they are, and it drives people's mood and morale down. So yeah, important to
Mhm.
celebrate wins. So there we go. Round of applause for general practice. We need to get that sound thing sorted out, Gandhi, so we can play random sounds at random times.
Mm.
That'd be really good. Were your needs met? Consistently remaining high. How would you describe your overall experience? Again, consistently remaining high, which is really good. And then they do ask some questions about the patients and how they see their health. And this
Mhm.
asks, do you have any long term physical or mental health problems? And actually remains pretty um, pretty stable over time. I do wonder if we watch this go back a few decades that might be lower, but that
Different,
might
yeah.
be wrong. And how confident are you that you can manage your condition? So that's pretty consistent as well. An
Mhm.
interesting trend that was completely unexpected in our data at the practice was people appeared to be more confident managing their own conditions,
Mm.
which we thought was interesting and obviously isn't shown in the national data. We were just puzzling out why that was. Um, and in the past 12 months, have you contacted an NHS service when you wanted to see your GP, but your GP practice was closed? I was just really interested to see this because I wondered if there'd been a spike because of the kind of pandemic of people
Mhm.
wanting to access us out of hours. Um, but apparently not.
No.
In fact, even less so for other people.
Yep.
In the people who have chosen to respond to this survey. And have you avoided making an appointment in the last 12 months with your GP for any reason? This is either a new question or a question asked in a different way. So there's only data from this year, sadly. I think that would have been interesting to see if people were avoiding seeing us because of COVID.
Mhm.
And I think that's the intention of the question, but there's no historical data with that.
Yeah.
So those are the questions that we thought were relevant, but we could have selected, different questions. And remember, we could have compared our practices with each other. We could have compared our practices with other local practices. So there's lots of interesting things you can do um, with the data. You don't have to compare yourself with the national averages, which isn't always fair for many
Mhm.
practices. So yeah, so that's the survey. Do you think it's how useful do you think it is, Gandhi?
Well, so a couple of points throughout that we talked about the demographics of the patients that filled in the survey, and I think that's something that I think we do need to talk about. The survey sent out as a postal survey to patients to fill in, and that may impact some of the qualities of the questions, like you said. So it's like a kind of like the census, but a much smaller version of it. And you kind of have to go through the booklet to fill in the questions and things. So does that impact the way people fill it in? Maybe. Does it also impact the type of people that fill it in? So is the proportion of patients that fill this in more towards the more elderly, stable, that kind of demographic? It'd be interesting to know. Probably could figure that out actually from the demographics of the data of the
I'm just running in the background. I'm just running another search, which will probably take
okay.
ages to run, which I think will tell us the just the ethnicity, gender, and age of the people completing the survey. So that should
We'll
pop up
see if that comes up, but I
in the
suspect that
background.
will tend more towards the elderly population, in which case, are we seeing more a reflection of what they would fill in? And what does that mean for those, for example, those mobile, younger patients who move around, who don't necessarily always fill in physical surveys, would prefer the digital version? Why don't we have a digital version? Why can't we just send this out en masse to all patients across the country?
I think you can fill it in online if
Mhm.
you receive and open the letter
Yes.
from them, essentially. So yeah, for the very first time this year, we had a conversation about. I think we've not looked at it last year. We looked at it this year, and we had a conversation for the very first time as to is this still the right way? Is this actually now flawed in terms of a method of collecting people's impression of their experience of using their GP?
Mhm.
Because I think it makes a big assumption, and that assumption is that the gold standard for accessibility is pen and paper. You send something to someone's physical address, and that means you're not excluding anybody. And I think that used to be the thinking around accessibility to to um, to people's opinions in a way.
Mhm.
And people used to say, "Oh, shall we send out something via email? Shall we send something out via text message?" And people would say, "What about the people who don't, who can't use that technology? What about the
Mhm.
people who don't have access to that technology? You're excluding people." And people never used to say that when you talked about doing things with pen and paper. But this year, a number of people in our practice said, hang on, what about the people who move around a lot? As you say, we don't.
Mhm.
We should have up to date address details for people, but students, some people move around a lot. Some people don't open their mail. Some people
Some people don't
open
speak
their mail,
English and therefore can't fill it in because they can't actually read or the
read
actual
or
survey.
read or write. But they might
Yeah.
get on better with their digital technology. Actually, digital technology automatically has accessibility features in
Mhm.
it. enable you to, there's text to speech, there's things that they can do with the contrast levels. Actually, I don't think pen and paper is the gold standard anymore, and
Mhm.
I think this is becoming old fashioned, and I think they need pen and paper, but they also need to complement it with some digital or other routes to access people's opinions.
Mhm.
I think it's had its day,
Mhm.
essentially, in terms
And
of.
actually, does that then mean that you get the perspective of a broader spectrum of the population? I don't know. Well, let's have a look at the results because I can see they're up, Andy.
Okay, so is your gender identity the same sex? Okay, I randomly ticked a few. So this I think is randomly interesting. I thought this might give us a male female breakdown when I was just trying to talk to you guys and also
Mhm.
select relevant things. But it's interesting. So we're identifying that there's sort of 2 or 1% of the population who identify as transgendered, transsexual, or in that category of not having the same gender at birth. Which
Mhm.
actually that's surprisingly large um, amount actually. So
Mhm.
that's interesting and uh, unexpected because I didn't. Thought I was clicking a different box.
Okay.
What's your ethnic group? Pardon me. I suppose we need to know what the ethnic breakdown for the UK is and some up to date statistics on that as to make the
Mhm.
judgment as to whether they are getting a representative sample for their surveys. So it's difficult to comment on that. There are a range of different ethnicities represented in the
Mhm.
survey results, and I hope they go through a process of making sure that that's correct. How old are you? So this is where so they are getting the opinions of a range of
True.
age categories.
Mhm.
I'd be interested to know, be interested to compare this with the actual, the population curve of the UK as
Mhm.
well. Um, it surprises me they're getting more results from younger people than I thought. Maybe it is
Okay.
fairly representative, but I know they don't get a huge number. I know when we were looking at our results, I think it was something like only 80 people had returned the survey,
Mhm.
which is a really low number on which to base decisions about how to run a practice, how
Yep.
to structure the appointment release, and how to judge a practice's performance. Because people do make inferences about how well the practice is run based on this data on this very
Mhm.
small sample sizes. And just to give you a comparison, we can get about 30. We send out a modified friends and family with some additional questions. We send out a link to that survey in a text message sent to everybody who has an appointment at the GP. It goes out automatically the next day. And we
Mhm.
get about 30 to 40 responses a month, to that, asking some similar questions to this. And we get that, we get a sort of month by month, much more real time
Mhm.
idea of what's happening. We don't have to wait a year for that data. And those people are definitely reflecting on the appointment they had the day before because we know
Mhm.
they had an appointment the day before. The trouble I have with this is more than 50% of people are reflecting on an appointment that is definitely more than 6 months in the past, maybe more than 2 years in the past.
Easily, yeah.
For some of these people, how current are these opinions? I think they can do a lot better. Is the
Mhm.
bottom line of my little mini rant there, Gandhi?
I don't disagree with you, and I think potentially using technology resources like the automatic reminder the day after the appointment to get more live capturing of the experience of the appointments. And can you then actually use the practice metrics to break that down by clinician type as well, much more effectively, which may give you better responsiveness in terms of how the practices work? I think is actually a really sensible idea. And should we be moving towards more better, you know, live kind of capturing of information. The question of obviously how you process and store and everything else, yes, that comes into it. The fact that it's an extra service, does it give you better intel? Probably. And maybe this is something we can look at the appointment systems in particular, being able to integrate within themselves to make general practice more effective at understanding its pressures, points, and stuff. I think it sounds quite cool.
Yeah, feedback's been an area that I thought there's a lot of opportunities actually. Imagine for a second that the government or the
Hmm.
government instructed one of these sophisticated survey companies or whoever to send. We'll get everybody's permission. We'll assume everybody is on board with this in terms of GP
Hmm.
practice. but nationally or regionally, send a selection of these questions, a shorter number of questions, smaller number of questions, to patients, immediately after they've had an appointment to reflect back.
Mhm.
Um, and they could collate that data on a practice level, regional level, national level. How quickly would we know if there were problems with access to GP appointments or problems with availability of clinicians in certain areas? That
Mhm.
intel could be used to really good effect to respond much more quickly to problems arising within
Yep.
general practice. I think it's a real opportunity, a missed opportunity, or missed until now, but it would be interesting if there were
Mhm.
proposals to do something much more real time. I think it would be useful together
Mhm.
with other data that we're collecting about GP appointments and appointment types and all of the other things that we're aware of in EGP learning land.
Mhm. Absolutely. So it'd be interesting to know what people out there think of our review of the GP survey and obviously how much weight they in particular put to the results of this. As you mentioned, different people put different weight. CQC pretty much insist on looking at this data. And as you mentioned, Andy, how valid is that data then? If it only represents 80 patients out of your practice, what, 7,000, if I remember rightly?
It's 8,000 now.
Yeah.
And how old
Mhm.
is the data that this appointment that was for 50% of people was definitely more than 6 months
Mhm.
ago. How current is that? I think we can do a lot better.
Mhm. And maybe we might help you do that. So if you do want to check out more details, feel free to check out more content and information we've got. So we'll probably have this video coming up right now that's actually Andy's experience of looking at near patient feedback and stuff and how he went about looking at some of the methods of trying to support you in terms of doing that. Alternatively, there's probably another one from YouTube or somewhere around here for you to have a look at. And as always at EGP Learning, we're here to help tech enhance your primary care and learning. And we will catch you in the next episode.